Hello, welcome to Healing with Ketamine. I am your host, Dr. Cassius Drake, and I'd like to welcome you to a special episode of our podcast today in honor of Mental Health Awareness Week month, where we're going to be discussing some of the current situation in the state of mental health treatment, and also discussing some new cutting-edge therapies and treatments that are being used today to support this very needed area. And to get started today, it's Mental Health Awareness Month, and this is, a serious problem in the United States today. There are about 57.8 million adults that suffer from mental illness, which is about 22% of the population. It's very prevalent in our young people today. You've never heard about the struggles of teens and youth and their serious struggles with anxiety and depression. It's affecting about 20% of adults. Major depression affects 8% of adults, and 5% of adults will have serious mental illness, meaning it's affecting their life or even resulting in them being hospitalized. Among youth, about 16% of it experience a depressive episode, and many are experiencing anxiety in their lives, manifesting in a myriad of ways. So there is a great need for mental health treatment and services. There's a significant shortage these days in providers who can actually provide this treatment, and some studies have shown that over half of the people that actually need treatment aren't getting it. And so why are the reasons for that? Well, some of it is access, some of it is there's a lack of good trained providers. There's also, for some people, a sense that there's not anything that really works. So, we have patients who have tried SSRIs, antidepressants. They've tried talk therapy, even amongst the people who have access to treatment and have tried it. Some of them are finding, well, this doesn't really work, or they find that, they're trying multiple medications, and their experience of mental health treatment is, well, I tried this medication, and then they changed the dose, and then I tried this other one, and then they changed the dose, and I tried this other one, and I'm still sort of in the same place. Or I tried cognitive behavioral therapy for years, and I never really seemed to get past anything. So, not only is there a great need in the population for mental health treatment, there's also a need for effective treatments, or treatments that people feel, this is really helping me, this is really changing me in a way that goes beyond perhaps some Band-Aid therapies. So we wanted to talk a bit today about some of the cutting edge therapies, new therapies that are out there that are showing tremendous effectiveness for mental health, for depression, for anxiety, for PTSD, for overall personal growth. And it's work that's very special to us, and that we're very passionate about. And so there's two areas I wanted to discuss today. I wanted to talk a little bit about psychedelics and the role that psychedelics are playing in the treatment of mental health, and also in the very cutting edge role that virtual reality technology and virtual reality therapies, as well as the support of creative work and mindfulness and meditation as an alternative, or what should be the primary approach, in our opinion, to treating mental illness. So, first I'd like to talk a little bit about psychedelics. So, psychedelics have been coming more into the forefront for treatment of depression, anxiety. It's very in vogue these days. You may have heard a lot about microdosing. There's a lot of talk about psilocybin and legalization of psilocybin. And of course, also we've had ketamine, which is available to treat many conditions. And a lot of people have a lot of questions about those. Is it safe? Is it legal? How do you do it? And in a guided process with support and integration coaching, psychedelic treatment is very effective and is very safe. It's becoming much more accepted nationally, and some municipalities have even gone as far as legalizing psilocybin, for example. In our work, in our practice, we use ketamine, which is an FDA-approved psychedelic that's been shown in many studies to lift depression, support people dealing with anxiety, profoundly effective for treating PTSD, and for helping people to evolve through their problems. I think many people we discuss with will say, I did cognitive behavioral therapy for 2 or 3 years. I tried 3 antidepressants and I don't feel any different. And then they come into a paradigm where they'll combine ketamine, for example, with a guided process that includes integration to talk about it, and it includes meditation and creative work, for example. And in that sort of holistic approach, patients find that they're able to achieve a deeper insight into themselves, and also on the other side of that, get some support that supports them in long-lasting transformative change. And we've seen this very, very often in our experience with patients in using these modalities. And Jacqueline, you're a partner in our work, and in our work we also bring in virtual reality therapies and creative work, and I'd like to give you an opportunity to discuss the very powerful role that VR creative therapies are playing in mental health today. So how do you use VR in mental health treatment?
Well, it's incredible, actually. But first of all, I just want to say, this month is really about bringing the awareness, right? The awareness to mental health, and really what that, for many people, the hope, the idea of hope, right? And so I'm excited to be able to talk about all this, especially about our therapies that are a little bit more non-traditional, I guess, in some ways. The virtual reality, yes, it's incredible for so many things. I personally have used it, as you know, for several things over the years. And the one thing that is incredible when we use it with our patients is that it allows them to, we use it for centering. We use it for centering purposes. We use it to teach them. VR has a tendency to be able to put you present, right? When you're inside of let's say inside of a meditation versus me actually guiding you into a meditation, it's a different experience completely being inside of it. And when you're inside of a meditation, well, you're immersed in it. And what that does to our minds is a whole nother thing. So we use it for that reason. I also use it with a lot of my art therapies as well. I love to be able to create in VR. It is just another tool for me as an artist, but it's also an incredible tool to be able to create and recreate a lot of their experiences that they experience that maybe we may not be able to paint out exactly. A lot of times I'm actually creating in 3D in virtual spaces with our patients, and really recreating some of their experiences, because with integration that is the most important thing, because when they go through these treatments there is a lot of insights that they might get, or visuals, or they might even hear things or have feelings of things. And when that happens, it's very important to be able to kind of figure that out for them, what is really important, but also to really pinpoint that out and to reinforce it. Right, and to be able to use that in the rest of their therapies with us. And so VR is just an incredible tool for so many reasons. And then there's this whole other thing about fitness. So when once my patients start feeling really great, they do. They start using, especially if they end up getting a device, they ended up using it for their own meditation practices. Then I introduce them kind of to a whole nother world of mental, mind and body wellness that is just profound when it's done.
So for someone who may not be familiar with virtual reality techniques, talk to me a little bit about how does that help with mental health? How does the experience of being in a virtual reality experience help someone with anxiety, for example?
Well, there's a lot of different programs inside the headset, right? So inside the headset, there's apps, basically. So a lot of different apps have breathing techniques. A lot of, and the way the device actually works is you're able to see the biofeedback with that, right? So you're getting haptics, you're getting especially for the breathing for anxiety, right? So learning how to use your breath to control your anxiety is a whole nother way. And so using the VR, I tell our patients to use it maybe once a day, maybe before they go to bed, or maybe in the morning before they go to work, put yourself inside of a meditation for 5 minutes or 10 minutes. That will change everything as you go about your day. And so giving them these kind of tools.
I can't meditate.
Oh, and that's the best part. So it's really created so you're able to be immersed inside of it. So even though you may not be able to meditate, or oh God, I would never do that, or God, we hear it all, right? Especially people that have never really, even thought about it, right? Or that's just something those people do, or it's something you do in yoga class or something, And it's really not. Meditation is really especially the way we teach it, with mindfulness being the root, is that we're really observing our thoughts, right? And so what VR does also is allow you to become present, and so it kind of gives you a space in between all the chaos of our monkey minds, as I call it, right? The monkey chatter. So being in VR also brings you present, brings you a little more centered, you become more aware of really what's happening in that moment. Versus when especially with VR fitness, for me, I have found that you become a moving meditation, literally. You're moving so fast to patterns that are mapped out that you're doing these repetitive, patterns, and you become a moving meditation. And a lot of my YouTube channels talks about that. But it's literally you become a moving meditation in it. And what this does to your mind, what it does to your thoughts, it allows them to land. It allows them, so all the angst, all of the stuff that we get, right? It allows people a place to land. And when you take off that headset, you're like, oh, wow, I am here. I am grounded. I am centered. And then you just feel incredible because you're dancing. You're literally dancing. So there's these other things that start to happen. The art part of it is also incredible because when you're creating in VR, there's a whole nother level of creativity and possibilities that can happen. I work with many programs now and do a lot of beta testing, as you know, but there's a lot of programs that are just incredible for the mind when you're creating, immersing you in different situations or different places to even kind of test you. There's one I was just testing out where you're actually floating and you're literally with moving, imagine highways of cars, and you're trying to focus and create in that space with highways of cars moving around you. And so what that does is it teaches you really to be focused in that moment. Okay. And focused concentration is one of the many mindfulness practices that I teach with our patients.
It's an opportunity to practice getting into a different emotional state.
Absolutely.
If someone struggles with anxiety in a stressful situation, then they can be immersed in a situation where they can practice some techniques.
Exactly. And what this really does is, it really reinforces that non-ordinary state of consciousness that ketamine psychedelics do. So when our patients have these incredible experiences within themselves, and they're going within their subconscious mind and really finding the beautiful things that are within them, right? And whatever that looks like, you never know. But whatever it is, we get those insights that they find out about themselves, and then being able to, reincorporate that somehow in their lives.
True.
And so we use all these different modalities for that.
Yeah, I find that part really fascinating about the neuroplasticity and the ability of the VR to reinforce that concept of a non-ordinary state of consciousness, which is, the term we use for the place that you go within a psychedelic experience, and that alternate state of consciousness, which is a very real state, but is not ordinary. So a non-ordinary state of consciousness. And then when you follow that up with a VR experience that really immerses you emotionally into a different place. It's reinforcing that aspect of neuroplasticity, of new neuronal connections that happen when you have these different emotional states, and that's the the brain rewiring, so to speak, that's discussed, that's happened, is when you have a real immersive experience into a new immersive state, either from a new emotional state, either from a psychedelic experience or either from a virtual reality experience. That's neurogenesis. When you feel different emotionally, that's a new set of neurons firing. You have a new neuronal net. Something new exists within you. And then reinforcing that with the VR and through creative work reinforces those neuronal connections, strengthening that and keeping and deepening and evolving those insights. So we find that using these modalities really elevates the whole experience. I know you also do a lot of work on creativity, and so talk to us about how being in the creative flow supports mental well-being.
Yeah. Well, I was just thinking too, with the neuroplasticity, by the time the patients come to me and we start to create and we're doing all sorts of interesting things, they always say to me, because when they come to me first, they're when they come to us for their treatments, they don't have space for this kind of stuff. Right? They don't have space. They don't have space, they tell me, for meditation practices or any sort of creativity. That's just, they don't have time for that. But what ends up happening as we go along in these treatments, when I start working with them, they tell me all of a sudden they have more space. And then I, explain to them, you actually do. You do have more space. The neural connections, the neural pathways, the neurogenesis, all of that, the plasticity is really happening. So you do have more space. You have more neural bandwidth, I call it. And when that neural bandwidth happens, yes, this is when we start to incorporate more practices, more meditation, regular practices, more creative practices. And the way I teach art, I always tell people, I can teach you how to paint a tree, but there's a lot of people that can teach you that. And I'll help you paint a perfect tree. But I'm more interested in the practice of it. I'm more interested into what's happening to our minds when we're creating. Where are we landing when we create? When I teach art therapy, it's about the process. I always say we're going to make a great painting. That's not going to not going to happen, right? You're going to have a beautiful painting, and if not, we paint another one. But we're going to paint something incredible. But let's talk about what's really happening when we're creating. Let's utilize that time that you're sitting as a meditation practice. Let's utilize that and literally, and so I give them tools to be able to actually make that a practice and to actually incorporate that into their daily life somehow, either with meditation practices or the art side of it. But it's always been about the practice because it is about what's happening to our minds. The paintings, whatever we create, that will come out no matter what. That's no problem. It's what's happening to our minds and allowing that inner peace to kind of come through, right? Because when we're creating is when our minds just allow all those little thoughts, all the things, just to kind of settle down. And so it's in the process.
Yes, it's very fascinating.
Yeah.
And so I love the synergy between the experience that people have in the ketamine treatment or psychedelic experience, and then reinforcing that with VR work or creative work, so that within the experience of a non-ordinary state of consciousness, where we have a new realization or a new perspective on things. I'm safe. As opposed to I have to take care of myself, or I'm connected with something bigger than me, and so I am cared for, versus I'm here alone. And so people have those sorts of powerful insights within these powerful experiences, and then you have to have a structure to do something with it. It's one thing to have the experience, and then how do I hold this? What do I do with that? And so it's important in psychedelic treatments and therapies that there's coaching, that there's guidance, that you have an integration process so that you can take these powerful insights and integrate them into your life. Meditating upon them, by doing creative work around it, by sitting in a VR experience that's been tailored for that experience. And all of these support neurogenesis, neuroplasticity, sustaining a different way of seeing things, so that not only does a person feel better in the short term, they're transformed, their perception of life, their relationship with life is transformed in the long term. And that's something that is very powerful, that we really enjoy seeing when that happens.
I think that's part of their resilience, right? That we're, you know, and another thing that always is they become present. You know, I would say with our PTSD patients, you know, realizing and recognizing it's really over. It's over, and really getting the insight that, you know, to live right now in this moment, in the present, is a huge insight for PTSD. When that happens, it's pretty beautiful. And then to be able to reinforce present moment awareness, and to be able to to literally give them powerful tools, practical tools, not just at the end of the yoga mat, you know, and we're just going to have a Zen moment. This is practical and really utilizing, you know, wait, where am I right now? What's really happening in practical sense. And so I love that.
What do you say to the person that has some trepidation about beginning psychedelic therapy, or they've tried everything, nothing's worked, and you know, why should I think this will work?
You know, well, that's pretty much every patient of ours that we get. People usually come to us after they've tried everything, right? They've tried a lot of things, and you know, first of all, ketamine is so safe. It really is. It's safe as long as it's done in the right way, right?
What is
obviously
the right way?
Well, I mean, I personally don't take my eyes off the patient when we're administering ketamine. I'm monitoring vitals the whole time and actually observing. If the patient, you know, looks like they're in any distress at all, something troubling come up in their mind space, we are right there to guide them and walk them through that. And so I do think there are many people that shouldn't have ketamine because of either their past medical history or their past psych history as well. And there's just some people that just, it may not work because there is a lot of work that needs to be done around it, right? So you do need to have a want to be better. You have to have that self-actualization and self-awareness to want to say, you know, it's time for me. And I want to add, though, that, you know, it's not just the patients that are diagnosed with long-term, you know, depression or, you know, anxiety, or they've got complex PTSD. It's not just for that. You know, many patients are coming to us now that are finding themselves, maybe they're not officially diagnosed for depression, or they're officially not diagnosed for OCD, or you know, even ADHD or whatever, but they're coming to us because, you know, things are just not working in their life. Things are not, you know, maybe they're just, you know, you know, obviously it's, you know, they've tried even looking at hormonal things, and maybe it's just a hormonal imbalance, you know, a lot of midlife stuff, right? And so people kind of blow it off as that. But there's also this real that, you know, maybe there is something underlying there. Maybe there was some trauma that's not, you know, being really, you know, to our forefront of our minds, I guess. And so to those people that, you know, are a little bit hesitant, you know, the ones that, well, maybe it's not for me because I don't really have those things. I'm not really diagnosed with that. Oh, I've never been seeing a psychiatrist, because we get lots of those, right? So, but to the people that are struggling, and I'm talking to the ones that are struggling silently, the ones that aren't saying a word about it, the ones that are the moms and the dads that are struggling because of whatever is happening in the world, they're worried about their children, and to the point where they're having physical symptoms, IBS or migraines or whatever it is. It's those patients that I really want to tell that there's some help now. There is some help for even the people that aren't officially diagnosed and in the traditional sense for that. But yeah, there is definitely hope and help now.
Yes, there's a lot of help for those people who feel stuck, who feel like nothing's going to work, you know, or because nothing has worked, and you know, that's, you know, for those people who are, you know, you've tried and you just can't seem to get past something, you've done all the work, and you just can't transcend. You know, there are techniques and therapies and treatments that can help you transcend those places. You can get past trauma, not in a way that you forget what happened to you, but in a way that your relationship with it changes, so that yes, that thing happened in the past, and there's emotions around it. And a person can find themselves in a place of being bigger than that and of legitimately and sincerely being in a state of gratitude for who they are today, even though something happened to them yesterday. And that's when that light goes on, I think that's one of the moments I enjoy the most. Is when someone finally is standing in today and they say, I'm happy with who I am today.
Yeah.
Yes, this thing happened to me before and it shook my world and changed me, but I'm at peace with who I am right now in this moment. And I'm grateful for who I am. And I even have the awareness that I wouldn't be this if I hadn't gone through that person, gone through what I went through. Getting people to that is one of our highest moments. And this collection of treatments and therapies works very you know, for achieving that.
So I think we find their authentic selves is what I always tell people. You know, when they have those insights like that, like you had just said, I always think, oh, there you are. There you are. There you are. There you are.
Or you found you.
You found you.
You found
yeah.
you.
Yeah,
you
and
know?
it's like their core, their authentic soul, and to see and to actually witness that is pretty incredible. And I'm grateful, so grateful for this work, and to be able to help as many people as we have helped in our little practice that we have. But it's pretty profound. And when all the, as you say, all the cylinders are working, everything is going, people really do change, and there really is this beautiful transformation of whole self, right? Of authentic self. And that changes everything. That changes everything.
It does. So, you know, in the spirit of Mental Health Awareness Month, be aware. You know, there are things that you can do. There are treatments out there that work, that are transformative, and that are new and cutting edge. So if anything resonates with you or intrigued, and I advise you to do some research and reach out and get the help that you need. The help is out there and available for you. And we encourage everyone to make that call, get that help. That is the hardest step, but it is the best one to make. Yeah. So as always, it's been our pleasure to be with you today, and thank you for your time and attention and hearing our information as we share our thoughts and passions on healing and wholeness and everything it takes to be a whole and happy human being. Thank you, and we'll see you next time.